recording. Hey guys, it's Dr. Jyoti Patel, and today we're talking about all things CBD with Charlie Piermarini from Restorative Care of Arizona. Welcome, Charlie.
Thank you for having me.
So, Charlie and I have done this before, but I know that we have new people watching all the time, and CBD oil is one of those hot and happening topics. People are always asking about CBD oil. They're seeing it in magazines, they're seeing it on the news, they're hearing it from their friends. And I wanted to bring on an expert in CBD oil so that you can get the real deal. So thanks, Charlie, for coming on and talking about CBD oil today.
Yeah, anytime. Thanks for having me.
So let's get started. So what the heck is CBD and where does it come from?
Yeah, right. It's alphabet soup. Everyone, CBD, THC, XYZ, who knows? But so CBD is what they consider one of the major cannabinoids. So CBD and THC are the highest produced portions or molecules within the hemp plant. So the hemp plant is living its life and it's producing these things inside of it. And we actually happen to have a whole system throughout our body called the endocannabinoid system that actually binds. And these molecules actually hit these receptors. And so has it that we actually have evolved, all mammals have evolved to actually produce molecules that are reminiscent and almost mere copies of CBD and THC called the endocannabinoid system. And it's fascinating. It's something that we're just really learning about since the early 90s. And we've only known about the molecular structure of CBD and THC since 1964. But we've been using cannabis and hemp as humans since we're roaming the plains for many purposes, for many medicinal purposes. And now we are now just realizing what it actually does and how it's actually interacting with our body. It's very fascinating.
Well, let me stop you there. You said for many medicinal purposes. So what kind of problems should somebody be thinking about when they're considering CBD oil?
Correct. So that's a great question. So, you're seeing today, everyone's saying CBD is going to cure this and it's going to cure that, but it's really what the research is showing. Okay. One is the FDA doesn't approve it for anything besides seizures. But what people anecdotally are using it for, what they're coming into my clinic, what they're seeing in other places is for pain, anxiety, sleep, inflammation, overall wellness. They're using the products for these purposes, even though if the research isn't 100% there, they're feeling that it's helping them and it's working for them. And I see it on a daily basis.
Yeah, it happens a lot that, something may be poo-pooed by conventional medicine, but patients really find that it works for them. And CBD oil is really one of those things where
100%.
Patients will swear by it. And I have a lot of patients that come in and have trouble with sleeping, or, they may have some chronic pain, and they apply the CBD directly to the knee or whatever, and it really does help. So
yeah,
I've seen that myself, that it's definitely anecdotally shown to be beneficial for a lot of people. So tell me a little bit about, because there's so much on the market, what kinds of forms does CBD come in?
Yeah, so it comes in many, many forms. The one that most people are familiar with cannabis in general is smoking it or vaping it. I've stayed away from that just because that whole field has been riddled with, the cartridges have been tainted and there's different products. So I've just kind of stayed away from it, even though it is a pretty good delivery mechanism. The next would be a tincture or an oil, when the actual CBD products, the hemp products, are dissolved into alcohol and then into a carrier oil, and you use this under your tongue or between your cheek, and it gets pretty high levels of absorption. Then we can actually use CBD as an edible form. Gummies are a very popular one. This is our sleep gummy with a little melatonin, very powerful. So you can eat it this way. There's capsules. So you can put it into a capsule and swallow it. Everyone's familiar with swallowing pills, so this is another way to deliver it. Or the one that you were kind of hitting on was the cream. A lot of people are using CBD cream, mixing it with essential oils, really rubbing it on your sore muscles, your neck, your back, your knee, really more of a targeted approach. These other ones, the capsules and the oils, are really good for an overall approach that I start patients on. So it's very patient specific. It's very disease or ailment specific on what you're trying to do.
Yeah, I had a woman come in last week who has irritable bowel syndrome, and she happened to borrow a couple of CBD gummies from her husband, And she reported back that, it helped. It
Mhm.
really helped her. She used to wake up every morning not able to move her bowels and had
Uh-huh.
excruciating pain first thing. And she reported back that when she took the CBD, it really allowed her not to have the discomfort, and she was surprised to actually have a bowel movement. One of the things the only thing that I could explain to her about that was, most of her irritable bowel syndrome symptoms are related to stress and anxiety, and that upregulation of the sympathetic nervous system. And somewhere along the way, that CBD helped dampen her fight or flight response, which may have then caused less spasm in her bowel and allowed her to have a bowel
Yeah.
movement. So this is anecdotal, of course, Charlie. I mean, obviously this was a patient that came in and reported it to me, but
Yeah.
are you seeing stuff like that too with the,
Yeah. Obviously working in the pain clinic, a lot more pain patients and a lot more anecdotal stories from the pain side, but a lot of patients that have, just arthritis or a lot of inflammation, taking some of these medications to try and get off of their other chronic pharmaceuticals, in conjunction with a healthy lifestyle, limiting your sugar and getting better sleep. These are great ways to kind of just get you back on the right track to get you healthy again. It's sad that a lot of people don't know what a good product is,
Mhm.
and it's taking time for people to realize, buying your medication from a gas station probably is not the best idea. I mean, I don't know, but
What
uh,
would you recommend? Where would you recommend, or how would you recommend looking for that perfect CBD
yeah.
product?
So go to the website of any reputable company, and look to see if they have any lab results, certificate of analysis, COA, lab analysis, any type of variation of those words or those, meanings. Click on it. See if they've uploaded what they're using. They should be batch testing. How old is that lab report? Is a lab report sent to a lab that's not held within that company, right? Is it a third party independent lab test? Is there a picture of the product that they're testing? How old was the report? Because we make a lot of batches at one time here, and we're a small company, so it may take a while for us to run through one batch. But you know, are they running through multiple batches, and that's an old test? You got to really look at where you're getting your products from.
Yeah, so it's really important. I tell people that too when they're buying supplements. Um, People have so many choices on the shelf. They don't really know, one, what they need to take, how much of a dose they need, and whether that company is good quality or not. So I do all the research and recommend that. I know you do the same thing. You do all the research for your patients as
Yeah,
well. Is there anything that patients should be worried about in terms of contraindications when it
yeah.
comes to CBD?
Yeah, I mean, just as well as I do, just because it's available over the counter doesn't mean it's safe, right?
Mhm.
All these medications that people are supplementing themselves with potentially can interact with their medications that they're supposed to be prescribed for life-saving things, right? Anticoagulant medications, anti-seizure medications. So what I tell people, and one of the good, rules of thumb is if your medication on the bottle says caution with grapefruit juice, that is 100% something you need to be cautious with taking CBD products. Any medication, statins, or any of these things are all usually run through the liver. When the liver
Mhm.
breaks it down, sometimes the CBD that you're taking or any supplement you're taking interacts with that breaking that mechanism. So it can make the drug render it inactive, or make it too
Mhm.
active. It all depends on what medication you're taking. So it's very important to making sure you're checking, is a legitimate product and should I be taking it?
So things like statins, blood thinners, anti-seizure medications, antifungals, these are all medicines that go through the liver. And if you're taking something like CBD, it could keep that medicine from being cleared from the body. And that can
Yeah,
cause the level of that medication to be elevated. And that can cause problems. So
yeah.
you should always check with your doctor. Yeah.
Fluoroquinolones and antibiotics are another big one too.
Another one. Yeah.
So really being careful. A lot of people are on those, for chronic UTIs or, you know,
Yeah.
they've got prosthetics and stuff. So it's
Yeah.
very,
And you're so right, Shirley. A lot of people take over the counter supplements and they don't realize that they can also cause harm and they could possibly interfere with something else that they're taking. So, talking to their doctor or getting a medical expert to help them navigate CBD oil is so important.
yeah, it's kind of a lot of the sessions that I do with patients when I'm talking to them about CBD is kind of just educating them about, you know, how to properly take it and what to watch out for, right? It's not a life-saving medication. So always err on the side of caution of, if you're concerned about taking this, talk to your cardiologist or talk to your neurologist or whoever it may be that's controlling these medications that are life-saving, and see
Yeah.
what they think. And if they're okay with it, then me and you will have a discussion and we'll monitor you.
Right. So I've sent my patients to you because you're the expert in CBD oil and you do such a great job. What can people expect if they call you to get advice on CBD oil?
Yeah, I technically, typically don't like to kind of give advice like that over the phone. I like to have patients come and meet with me in person, bring their medication list, talk to them what their goals are, do a physical exam. If they've got back pain and they've never seen anybody for it, why do you have back pain? Some of the acupuncture, dry needling stuff that we do here can sometimes help them with simple stretch.
Right.
So, people sometimes seek out supplements, and me and you have this discussion all the time. It should be supplementing what you normally should be doing. So, why are you taking this? Maybe you're lacking or deficient in something else that it's an easy fix. And so it's all kind of just putting the pieces together.
I love that. I'm totally about root cause medicine.
Yeah.
People come to me too with an idea that they need to take a vitamin or supplement, and I always tell them you can't supplement away a bad lifestyle.
Yeah.
You've got to really fix the underlying root cause of what's causing the pain or causing the insomnia or causing the stress. But sometimes the supplement can help them cope until we figure that out or until we have a chance to rebalance. Yeah. So I'm totally on the same wavelength there. So if folks wanted to call you or talk to you or schedule an appointment, how do they do that?
Yeah, great question. So I'll pull up my website. So the website is restorativecbd.com. And when you go there, you'll see that I've got a lot of videos, a lot of content. You can purchase products through my website. I ship all across the country. And I've really put a lot of work into showing people what CBD is and what the endocannabinoid system is, and really trying to educate everybody about how it helps you and what it can and can't do, right? If you're taking this to cure your cancer, I definitely would check with your oncologist before you stop taking any medications. But, it's definitely another way to just educate the public. And that's kind of what I built my company on. I've got you and I have been talking, I'm launching an online course to help people really try and, at their own pace, learn about the CBD and learn about the endocannabinoid system and hemp and marijuana. And it's a process to really just educate people.
So this course is going to be on your website where people can...
Yeah, I'm launching it in the next couple weeks. The content's finished now, just kind of going through it. It'll be launched. It's got quizzes in it. You got a certificate of completion when you're done. It should be done the next couple weeks. I'll put it through my website, and I just really want to educate, patients. If they buy my product, that's great. But if they're educated and they buy someone else's product, that's just as good. I want people to be able to get good product and good education and really know what they're doing.
And I love that, Charlie, because it's not just the patients. A lot of providers, doctors, PAs, nurse practitioners, ancillary providers, chiropractors also want to learn about CBD, but we're so stretched thin, we don't really have the time or the bandwidth to go doing all the research. So a course like yours might be a good place for us to start as providers to be able to learn more.
Yeah. I hope you expect to take it soon. You better pass.
Yeah. It's on my next certificate list.
There you go.
Well, thanks, Charlie. I'm so glad that you joined me today. Thank you for everybody for watching. If you have any other questions, don't hesitate to give Charlie a call or visit his website at Restorative Care of Arizona. All right, take care, Charlie. Good to see you.
Thank you for having me.